8:32 on this Tuesday, December 19th. Good morning. I'm Tori on your hometown station, KHTS. In studio with me right now is Dr. Jarrett Williams, family medicine and full-time urgent care physician at Kaiser Permanente, Santa Clarita. Welcome, welcome, welcome. Happy holidays.
Happy holidays. Good to be here.
So nice to see you. We have huge news to talk about.
Big.
Almost kind of don't know where to start. But let me just talk about, first of all, right now, where are you located? Where's the Kaiser Permanente facility located, where you are?
We are on Turney Road in Santa Clarita at 27107 Turney Road.
On Turney Road.
On Turney Road.
Now, come March of 2018, what's going to happen?
We are moving our facilities down the road, or expanding really our facilities just really down the road. We're bringing also a lot of our other urgent care, our other ologies to the table as well.
Ologies, and I have a whole list of them. There are a lot of ologies. You've got cardiology.
Yes.
You've got endocrinology. Am I saying these right?
You're right on base.
Because I didn't get my medical license yet. It's still in the mail.
No, it's
so
totally.
I should get it today.
Totally.
Neurology, nephrology,
hematology, oncology, general surgery,
ophthalmology,
ophthalmology.
Then we have some stuff that doesn't rhyme. Pain management,
right.
Physical medicine. We've got urology. Oh, that's an ology. Infectious disease. Mm-hmm. You really are covering 64,000 square feet of amazing stuff here.
Absolutely.
And we're pretty excited to have you in town. This happens in March of 2018.
Right around the corner.
And when this happens, you're going to mix the urgent care?
No.
What's happening?
Urgent care is just moving down the road. Our urgent care is going to be transferred down the road, but with expanded services. Just really the building, everything is just built around our patients and our members, and urgent care is just moving.
Now, when we say urgent care, as just a regular, layperson like myself, I have a vision in my mind of urgent care. It is kind of if you have to go someplace quickly, but it's not emergency room, like, hurry, but you may be sick, or you may have hurt a person, maybe a bone or something. Yeah. Am I on track with going to urgent care versus emergency care? Can you explain the two differences? When should you go to urgent care versus when should you go to emergency room?
Absolutely. Very, very good question. Very common question. One of the biggest differences I would have to say is sort of the doctor and the resources that will be available to you as you go through that service. It's not that we can't start to take care of those high acuity stuff, because we can. Great team of nurses. We have emergency room care nurses that have had critical care experience. But it's really the difference in the type of doctor and sort of the background of people that you'll interact with. Mm-hmm. Now, if you're emergent, we'll be able to identify that, and we're going to take care of you. But that may mean 911 if you're really bad. Otherwise, you may kind of go into you're sort of simmering on fire, so to speak, and we have to stabilize you before we get you over to the hospital.
Got it.
Versus that you just need a medication refill because of you lost them, or you have a laceration, broken bone, what have you.
Ooh, laceration. I've heard that on TV.
Yes.
Laceration. What is that? Like a cut. A big cut, like yes. A deep cut, right?
Deep cuts. Not too bad. If you're bleeding very badly, maybe consider the emergency room. But yes, for a lot of cuts, we can take care of that.
But this is going to be a high tech in March of 2018. It is super high tech. I mean, you'll be able to check in yourself on a kiosk. Mm-hmm. You can make a phone or video appointment. I mean, come
Absolutely.
On.
Right.
This is cool stuff here.
Next generation of medicine, really. The goal of the building is to really sort of integrate health and have a hub available to people where you can get everything sort of taken care of. Hence why bringing the ologies to the table. Hence why, having walking paths and sort of tablets that you can interact with preloaded information about, sort of the diabetes that you're dealing with, or the chest pain that you have, and what you can, talk about and learn. It's really an integrated care experience that we're aiming for.
So we're looking at next level stuff here.
Yes, absolutely.
We were talking before about, we were laughing off air and having a good time before we started this interview. And I said, dude, I want you as my doctor.
Hey,
and he said, but why wouldn't you want to be fun? Why wouldn't you want to have a good time? I mean, you have to take care of things that are important. But while you're in that appointment, why, and I'm going to answer that question. We're turning the tables here. Yeah. I've been to doctors' offices where there is no bedside manner. And I have quickly left because I am one of those people who needs bedside manner. I need you to talk to me. I need you to smile once in a while. I need you not to rush in and rush out of that inner office. Once you're in the small office and you're waiting on the paper, and doctors will rush in and rush out, and you feel like you can't ask questions, you can't smile. And so having you in here and us laughing and having a good time before your interview, that's what I'm looking for.
Yes.
That's what I'm looking for.
Yes.
So does that answer your question? I mean, you could be one in a whole bunch of doctors, and these doctors could be great doctors, but I need the bedside manner. How do you feel about that?
It sort of defines me in my patient room, I judge. It really is, because I've also been on that side of really kind of being impersonal, and I've heard other conversations. I work with these people, I work with doctors and that kind of do that. We can fall into that because we're very busy and we sort of can turn off. But once you establish that kind of that personal link with somebody, I mean, that really in some ways is a healing aspect of it within itself, just connection.
Absolutely. That's what I think.
So, it's important in a visit, and I know that for my urgent care colleagues especially, I judge we excel at that because we not only have fun at our job, but we can connect, and I like to think that we're pretty intelligent too. But
it is so important. It's so important to connect. And speaking of connecting, now we're getting into the holidays. Do we get sick at the holidays? What happens?
Of course we do.
What happens to urgent care?
We will, I joke around that, sort of right before Christmas, there's a silence before the storm. People are preparing for holidays. People are maybe pushing things off, I judge. And right after sort of Christmas, the New Year's, we get inundated with people. You're now sick. You may be worn down. What have you. So we really get pretty heavy.
So January 2nd, look out.
You watch out.
Here
Yeah, but hey, we will be there. We will be there. We will help you.
Excellent. Looking forward to. Is there going to be a big party in March of 2018? Are we going to cut a ribbon? Are we going to do some stuff?
Wonderful question. I judge that we will. Kaiser likes to really, present themselves well, and I judge a ribbon cutting ceremony would be a very nice way to open the doors.
Right? March of 2018. Such a pleasure having you and talking to you. Dr. Jarrett Williams, family medicine, full-time urgent care physician at Kaiser Permanente, Santa Clarita. It's such a great talk. Nice having you here. Come back again when we're going to open. In a couple of months, right. Let's celebrate. Let's do this right. Let's eat a cookie together.
It sounds good. Or two.
Happy holidays to you. Thanks for coming in.